This is Biernacki, and I'm talking about the best treatments you can do at home for your Ehlers-Danlos. We're starting now. Ehlers-Danlos is Googled almost 300,000 times per month across the world. Very, very common disease. More research, more studies are being put into this. I talk about how to do a home test to find out if you have this. I go over how to do that below. It's a 9-point scale you can do at home, but this is a genetic disease that does need to be managed. As of yet, there's no cure, even though there's phenomenal gene therapy, stem cell therapy, genetic screening, and new tests and treatments coming out. They're not quite ready yet. So we're gonna go over in order from top 10 to the number one best treatments that I find for my patients that make a huge, huge difference in taking care of your knee pain, your fatigue, your leg pain, and making sure you have as little problems as possible. Because the tricky thing is there's a wide spectrum. You could have very light Ehlers-Danlos where you're just a little bit hypermobile, or you could have it really bad where you have vascular diseases, eye issues, a lot of other issues. So it's important to get properly tested. I've got guides on all that. But here we're going over the top 10 treatments that you can do to start getting yourself better if you're hypermobile and hyperflexible. Number 10, surgical interventions. These are life-saving procedures if you have aorta issues or blood vessel issues or joint instability. I'm not going to go into depth here. The goal is to prevent that. Number 9, education and awareness. Statistically, most Ehlers-Danlos are not diagnosed correctly. So now there's genetic testing, there's screening available. So now more than ever, diagnosis is getting better and people are getting treated. Did you know somebody in high school that can bend their thumbs back, bend their fingers back, and you can't? That might have been Ehlers-Danlos, but they just weren't diagnosed. Number 8, psychological support. Now listen, any genetic disease, I'm not gonna go into depth here, can get you depressed, can get you down. There is help, there's counseling, there's support groups, there's a lot of health available. Check those treatment options out. Number 7, cardiovascular care. There are medications, so if you have high blood pressure, it can put stress on your blood vessels. So there's beta blockers, there's antihypertensive medications. I have a lot of great videos on the best blood pressure supplements and diets. I link those down below. But the Journal of Vascular Surgery shows that these can make a huge difference and really help the quality of your life. Number 6, pain management. Now, the goal isn't to focus on taking medication. It's available. I think the other 5 things we're going to talk about can more dramatically get your pain down. There's anti-inflammatories like ibuprofen, acetaminophen, opioids, antidepressants, anticonvulsants. Not that you're depressed, but what these do is they make your nerve function fire less to your brain so you don't feel that chronic pain as much. There's a lot of great evidence. What I always recommend to my patients is there's a lot of great nerve medication creams. So there's a lot of great creams. Rather than going into them, I have full videos. I have links on my favorite nerve creams down below. Check that out if you're interested. Number 5, occupational therapy. Most people don't know that home care is fully covered under most insurance plans, but occupational therapy can actually come out and check out your house. Do you need support bars? Do you need gel pads to support you? Do you need your day evaluated? That's what an occupational therapy does. They can see if they can help with balance aids, walkers, potentially a cane, shoes, different things like that. So these are available. Ask your doctor about them and they can get help. Number 4, dietary adjustments. Weight management is the number one thing you can do for most people with flexible ankles, knees, feet. Everybody already knows this, but simply counting your calories, using a trackable app, that's the biggest thing. Getting your steps in, so 5,000 to 10,000 steps per day, and strength training, which we'll talk about. But as far as diet goes too, there are a lot of great supplements you can take for your collagen, which affects Ehlers-Danlos. Vitamin C is number 1. So make sure you're getting your daily dose of vitamin C. That's oranges, that's different citrus fruits. You can take supplements as well. And you want to take collagen itself. That can make a big, big difference. There is evidence showing that these things help, but also nerve pain, joint pain, arthritis pain, I have guides on the best supplements, the best diets, the best foods. We're talking things like alpha-lipoic acid, the B vitamins, different types of magnesium, different types of vitamin D. Check those guides out below. Number 3, bracing and support devices. This is huge. This might have even been number 1. But check this out. When I take my foot right here and you flatten down, it stretches the inside of your ankle. It stretches your plantar fascia, the ball of your foot, your heel, your knees, your hips. But look at, when you take an insole right here, I'm pushing down. See how it's not flattening out right there? But without the insole, see how it flattens out? The insole does a lot of that work for you. With Ehlers-Danlos, you're basically hyperflexible through your ankles, your knees, and your hips. Simply getting this insole, I've had patients, the majority of their pain disappears and they're just good. If that didn't work, get good shoes, good slippers. So I'm a little bit biased. I work with a company called Ortho, but I got these for my parents, for my grandparents, for my aunts, my uncles, basically anybody with foot pain. These are unbelievable. The #1 orthopedic shoe, in my opinion, and I think statistically too. But if you want cooler running shoes, Hoka is a great brand. Brooks is a great brand. Asics, On, there's a lot of great shoes out there. They can give you a ton of support. And also check out the slippers. If you're at home quite a bit, get supportive slippers at all. That can make a big difference. And then an ankle brace. If you have foot drop, if your ankles are unstable and you sprain your ankle, an ankle brace is the next step up. These are easy to put on, they fit in your shoes, and they give you much better balance. So I'm balancing a lot here, but right here I'm standing on one foot. With an ankle brace, they've done studies that you have to use like 1/3 the effort to stand and support yourself, versus without an ankle brace, you're much more likely to topple over and get more fatigued. So shoes, slippers, orthotics, and braces in order makes such a big difference. Check out my favorites down below. I got them ranked. Number 2, lifestyle modifications. This seems so simple, but it's so effective. If you work in like an Amazon warehouse, if you're on hard concrete all day, if you work a physical labor job, you have to figure out something new in your life. Try and transition your career to get a sit-down job, because the reality is this is a genetic disease that is not curable. You don't want to blow out your knees by the time you're 60, 70, where you can't walk, where you blow out your feet, your ankles, your arches. That can make a big problem for you. If you're visiting a podiatrist like myself, we can write you letters to have modified work activity. And I've seen most employers, they're actually really cool. I had a patient working at Costco, and Costco completely switched her job description so she's not damaging her feet anymore. So in that case, I really like Costco. They're really good to their employees. And number 1, strength training and physical therapy. Yes, it's one of the most boring ones, but it is by far the most effective. If you strength train your leg muscles, your calf muscles, your hip, your core, your upper body, we're talking like 2 to 3 times of 30 minutes per week, it will change your life. That is by far the most exceptional thing you can do for your Ehlers-Danlos syndrome. Stronger joints, stronger muscles. Over time, you will get stiffer, you will get more supportive. And with that support of the good shoes, the good orthotics, dropping that weight, it will all just add up. That chronic nerve pain will get better. You'll be more functional, you'll move better, and you change up your life a little bit so you don't have to stand all day. And for most of my patients that I've seen, not everybody, because it really does differ and it can get really bad, but most people do dramatically better. I'm saying at least like 75% improvement. And really, that's all we can ask for in this case. Check out those links below. A lot of great insoles, braces, everything you need. If you need a test to diagnose Ehlers-Danlos at home, check that out below. I got that linked.